Hello, I'm Randall Morgan, President and CEO of the W. Montague Cobb National Medical Association Health Institute. A key goal of our mission is to reduce persistent racial and ethnic disparities in health. To overcome racism in medicine, we are increasingly aware of the need to focus on mental health. There is a stigma that creates barriers for Black Americans. As an orthopedic surgeon, I am well aware that there is a lot all physicians can learn about this important issue. This program will introduce some of the factors that we can recognize and change so people can get the help they need.
We all know too well that there are disparities in access to healthcare. One of those barriers is not about politics or policy or economics. It's about culture, the stigma about mental health problems that gets in the way of getting help. Stigma can have a profound effect on the patient-physician relationship.
Patients might not recognize their feelings and symptoms as mental illness. For example, we know that Black Americans often experience depression as pain, or they might feel they are lacking in faith instead of needing medical care.
The need to understand and address mental health issues among Black Americans is crucial. According to the CDC, African Americans are 17% more likely to experience anxiety and depression than whites. Social justice issues, including racism and economic inequality, exacerbate existing disparities in access to health care.
Too often, clinical mental illness goes undiagnosed, either because people are not seeking care or they resist it because of stigma. As a result, we see compensations in all kinds of ways, from manic workaholism to self-destructive actions and habits.
The American Psychiatric Association reports that differences in how Black Americans express symptoms of emotional distress may contribute to misdiagnosis. They are also less likely to be offered evidence-based medication therapy or psychotherapy. And the APA cites research that indicates physicians are less likely to engage in patient-centered communication with Black patients. These are barriers that can be overcome with awareness and education.
Along with teachers, family members, and even pastors, physicians need to recognize mental illness, even if that's not the reason a patient has come in for care.
And for patients who are diagnosed and are on medication, physicians need to make sure they're adhering to their medication, even while being treated for other medical issues.
Recognizing and supporting patient mental health includes encouraging adherence.
It's important to help patients develop a community of support to make sure they stay on medication and go to appointments.
Physicians can help patients manage mental illness by acknowledging it and encompassing it in an overall treatment plan.
As trusted authority figures, physicians have a vital role in cutting through the stigma so patients can address their mental health.